In Medicine and Money, cuts to drug prices are happening within Medicare, but also for disadvantaged patients through the government's 340B drug program. Joining us now with more is Peter Pitts, president and co-founder of the Center for Medicine in the Public Interest. Good to have you with us. Tell us about your organization.
Well, I'm a former FDA associate commissioner, and when I left the FDA, I started CMPI to look at initially at FDA reforms to bring innovations to market more swiftly and more safely. But very quickly that kind of broadened out to the broader healthcare policy experience in the U.S. and especially making sure that needy patients without insurance, have access to the healthcare that they need. So it's become kind of a broad spectrum think tank on healthcare issues.
What do people need to know about this 340B program, and what is the original purpose of this initiative?
Well, the 340B program, which started in 1992, is designed to allow not-for-profit hospitals largely to buy pharmaceuticals at about a 50% or greater discount so they can serve their needy, uninsured communities. The problem is that these days it's about a $43.9 billion industry. It's the second largest program after the Part D drug benefit. And what hospitals are doing is rather than passing along these savings to needy patients, they're pocketing the difference. They're profiting to the tune of about $13 billion a year while simultaneously cutting charity care. There was a study done by the GAO that showed that the 340B dollars are being shifted away from needy, uninsured patients because what the hospitals do is sell the 340B drugs at full price and they pocket the discount. So the intent of the legislation is being entirely overlooked, and this has got to change.
What's been the response from hospitals? What's the defense?
Well, of course, hospitals are pointing fingers at the pharmaceutical industry. And the pharmaceuticals industry is saying, listen, we're more than happy to provide these drugs at these prices. It's important. We're supposed to do it. But you have to pick up your end and do the right thing and make sure that people that need these drugs are paying the 340B price. And there's a lawsuit. And I think that ultimately the government's going to have to get involved because hospitals say, well, we're not breaking the law, but they certainly are breaking the intent of the legislation. It's bad karma.
What can consumers do?
So, I think people who live in communities and these figures of hospitals that are abusing the system are public. And there are many of the nation's largest hospitals, Cedars-Sinai, New York, Mass General, Brigham and Young, Cleveland Clinic. People need to call hospitals' public relations departments and saying, why aren't you doing the right thing? They need to pick up the phone and call their congressmen and their senators and say, why don't we fix this system so the original intent is returned? You simply can't allow hospitals to pocket this money, cut their charitable care, and get away with it. And this doesn't mean that doctors and nurses and pharmacists and all the people that work in the hospitals are to blame. This is all on the hospital administration. They are betraying the mission of their institutions. And I think the public needs to get engaged. The report is available at cmpi.org. It's written in plain English. People should read it, they should get angry, and they should take action.
Thank you for all of your critical information, Peter.
You too now. Bye-bye.
Go to businessfirstam.com for where to see our show on TV.